And today, I would like to speak to you about one of the drugs.
Everybody's on the internet this morning.
Yep, could be. Well, we'll go with as far as we can take it. Let's start.
Let's do that. Let's do that. Let's get going here. So let's just jump right into it. As we're going to just continue our conversation from yesterday regarding a Q&A when it comes to Parkinson's medication, and just some of the questions that came up from our discussion with our Power with Parkinson's peeps the other day. So let's jump straight into kind of a continuation. And I just, if you don't mind taking a moment, in addition to hallucinations, do you get the whole idea, or not idea, it's very real, the sundown syndrome effect? And could it be related to medication, and what can people do regarding sundown syndrome?
Yeah, so yes, to part one of that, a lot of these hallucinations are usually in part due from the medication. Almost all of the medications that we use to treat the motor symptoms in Parkinson's have the ability to cause hallucinations. Some of the more prominent ones that are notorious would be the dopamine agonists, which would be comprised of Mirapex, which is pramipexole, Requip, ropinirole, rotigotine. That group of apomorphine, these are the ones that are usually the biggest culprits, but certainly not the only culprits. So that's what a neurologist would look at, number one. And very often it's just simply a dosage adjustment if brought to light early enough. Usually just a small reduction in the dose, or perhaps they may change the medication entirely, depending upon what the neurologist sees. But in most cases, at that point, it's generally a relatively easy fix.
Okay.
As far as getting the circadian rhythm involved with all of this, particularly at sundown, a lot of that has to do with, again, our circadian rhythm based on a 24-hour clock. And you see what happens, especially, and for all of us, but more so in Parkinson's, as that sun goes down and the day progresses, the brain is at its weakest point. It's tired. It's been bombarded with medication all day. And it has a tendency to play tricks with us at those, as opposed to the bright sunshine daytime part of the day when we're up and we're active. Usually by the end of the day, we're more relaxed, we're tired. And that's when things get a little tricky sometimes for patients. So there is something to that. Restless leg syndrome is a classic example of how our circadian rhythm works. That this is a disorder that only comes at one time of the day. Usually when you have a disorder, you have it 24/7. Here's a kind of a weird thing that as the sun goes down, the problems and the symptoms get worse and worse with restless leg. And miraculously, the closer we get to dawn of the next morning, those symptoms seem to magically disappear. So, even though it is considered a sleep disorder, but it certainly has something to do with our circadian rhythm. So your factual stuff, I'm not really sure. It's tough to kind of narrow that down, but clearly patients will tell you there's something to that.
Yeah, absolutely. And just knowing to have that conversation, and again, back to our previous video, it might even help future if, as soon as you see those little small, movements behind you that you're not even sure if you even saw anything, like nipping it right then and there, seems to be the best, fantastic advice regarding even preventing future potential.
And I'll tell you, another quick part to that is, we've talked about these passage hallucinations that they get on the periphery of their sight. Sometimes the patients they'll get a feeling that there's someone behind them, or that there's someone in their space, and they'll be like, they have to turn around and look. That's just how strong the feeling is. And of course, there's never anybody there. And then sometimes it can even grow. They feel them immediately behind them, and then it could be even further and further back, and maybe even in the next room, but where they're going to have to go and see what's in there. that also is kind of a preceptor to hallucinations as well, where they get this weird, strange sensation that there's somebody in their space kind of thing. And of course, like I say, there's never anybody there. But that's also a clue that should be passed along to the neurologist. If the caregiver is seeing that, many times the patient will just brush that off and say, no, I don't know what the heck that was, whatever.
Yeah.
But, you wouldn't think, and we've all had that sensation. We've all had that feeling at some point in time that we feel like there's somebody there. But it's a little bit more concerning for them because it may be an indication of something coming down the pipe. And also yesterday, I wanted to just add, we talked about water very briefly yesterday and how important that was mostly on the digestive end. But a question came up the other day when when I was at the gym with you. Someone had mentioned carbonated water. And there's quite a bit of information out there. What's happening is they're saying that the carbonated water may help to speed up the levodopa, carbidopa getting out of the stomach, as opposed to plain water.
Right.
Now, I couldn't really find any clear clinical studies as far as that's concerned, but I can tell you there's a substantial amount of anecdotal information out there, so much so that there may actually be something to that. So for those people who are really not water fans, and there are a few out there, I get that, especially when you've got to drink 6 or 8 ounces, glasses a day, you might want to try switching to a carbonated beverage. And I'm not talking about beer, number one. I'm not talking about, I don't want you to drink a half liter of Coke or Pepsi either. I'm talking about just regular water that has maybe some of these flavored waters have some carbonation to them. You may want to try that there's still 0 calories. And they do say that helps, that carbonation helps to pass it out of the stomach and into the small intestine faster. It's worth a try.
Right. And I'm a fan of carbonated water. We have a soda streamer because
so am I.
Yeah. There's nothing that quite quenches your thirst like a big old, glass of carbonated water. So, and there's ways, now we can make it at home with our soda streamer and it's super fantastic. So
exactly.
Hey, it makes drinking water way more fun. That's for sure.
Oh, without a doubt. Especially like I say, when you're trying to get 60, 70 ounces of water a day in, it could make the difference.
Yeah, absolutely. Now, just real quick, I did want to ask you, and we've got a couple of things we want to jump to, but as I was reviewing some conversations and it's sort of on the same thread as hallucinations. So just a couple more minutes, and it is the impulse control. I mean, I know it's not really the same thing as hallucinations, but at the same time, it's come up about 2 times just yesterday in conversations with different people with Parkinson's. And I think it's something that people actually, one, the caretaker needs to know, because probably the person who's got the impulse control or the extreme feeling, like the I don't know, the over feelings of whether it's, what's the word I'm looking for, when not typical feelings. And I'm just, for lack of a better word, the one conversation I had yesterday was a daughter was asking about her father, who for the first time ever had like crazy sexual thoughts, and he was in his 70s, and he's never done this before. And so that seems to be in the same category of that impulse or that exaggerated thinking or feelings. So brush on that real quick regarding that in medication.
Yeah. This is definitely a problematic side effect of a medication, specifically the dopamine agonist group. They are, although all the drugs in Parkinson's for motor control can cause impulse control disorder, it is typically the dopamine agonist category that we associate that with. And of course, that being the drugs like the pramipexole, the Mirapex, the Requip, the Nupro patch that they wear, apomorphine. These are dopamine agonists. Now, what dopamine agonists do is basically they kind of augment dopamine in the sense that they're an artificial form of dopamine. They're not true dopamine, but they trick our receptor sites into thinking that they are, and they get a response by doing that. Unfortunately, 2 major side effects with this group, which become very problematic: impulse control disorder and daytime sleeping.
Oh,
So we'll
yeah.
start with the impulse control disorder. Now, what this is an exaggerated compulsion to do some of the things that we all like to do, but only in an obsessive, compulsive manner. And that could be gambling, it could be shopping, it could be hypersexuality. It could be anything it could be even, I saw an interview with a woman that she had a tin box. Probably everyone remembers, your grandparents
Yeah.
had a tin box with every kind of button imaginable, round buttons, square buttons. And she had this tin box, and every day, all day long, she would sort them into all the round buttons, all the square buttons, all the buttons with 3 holes, all the buttons with 2 holes, all the buttons with 4 holes. And that was her compulsion. She did that all day long. That's part of an obsessive compulsive behavior. And that can be very problematic for patients. It can ruin marriages. It can ruin lives because they can gamble retirement funds. There was an interview that I watched, a neurologist speaking to a daughter and the father. The father was the PD patient, and he just blew through almost 100,000 of his retirement fund. And the daughter he didn't think anything of it. She brought it to the attention of the neurologist. And when the neurologist asked the patient, he could have cared. Like, he goes, oh, it's don't believe her. It's not 100,000. It's probably more like 50, 75,000. But even still, no matter what,
Yeah.
it doesn't really matter. And when he was asked by the neurologist, do you still go out and gamble and stuff? And he was like, oh, yeah, no, I go out every day. My daughter doesn't think that I do, but I go out there every day. I spend probably $50, $75 every day. And not that he has the money to do that. So it can be extremely problematic. And as you said, a lot of times the patients don't even realize they're acting that way. They don't see it as a problem. It's more from the caregiver. And if you've been put on a dopamine agonist, you need to make sure, although the neurologists are very good, but they need to ask that question. They should be asking that question on every visit. Have you noticed any behavioral changes in your partner? Have you seen anything? And if they're not asking that question, then you need to bring it to their attention, something like that, because that progresses rapidly, and it can be very, very destructive to a relationship.
Yeah.
The other thing was the daytime sleepiness, what they call sleep attacks. This is not your ordinary feeling drowsy or tired. This is something that comes on very suddenly. You can be in the middle of a conversation, and then all of a sudden the patient is asleep. They don't have any recollection that they were tired beforehand. Very often while they're sitting in a car at a stoplight, they can fall asleep. And that's a problem. I often tell people, I say, a lot of times we see about these accidents that take place here in the villages, where they say that the driver had a medical incident. Sometimes I wonder, did they have a sleep attack while they were driving? Still in the United States, if you are on a dopamine agonist, you are still able to obtain a driver's license. In France, for instance, you cannot obtain a driver's license if you are put on a dopamine agonist. They take it much more seriously about that in other countries. But in the United States, you can. You can't get a pilot's license in case you wanted to learn how to fly, but you can get a driver's license here in the United States.
That's interesting. That's an interesting fun fact. Right there with the pilot's license, but this is serious, something.
Yeah, it can be.
And of course you can't prepare for it, so you have it probably the first time it happens, and hopefully the first time it happens is in a safe
and that's why a lot of times the neurologist, again, to their credit, knowing that you're on a dopamine agonist, a lot of times they'll ask you those 2 questions. One, have you seen a behavioral change to see if they're having any behavior issues, impulse issues, and 2, are you experiencing any daytime sleepiness?
Yeah.
Because that's usually the clue right there, where if the caregiver notices all of a sudden, just out of the clear blue, he just sat down 2 seconds ago and he's sound asleep, or he fell asleep in the middle of dinner last night. Those are clues of potential sleep attacks that could be very problematic down the road.
I have one of my gentlemen in my classes that, he talks about having extreme fatigue that just hits them. And I'm wondering if it's something in the similar kind of category. However, the main thing it seems like right now, especially when I think about the behavior change, because the one who's experiencing it, even if it's subtle, probably doesn't take a note of it, but just the whole idea that it, like even the smallest things that seem different about your father, your husband, your wife, that person in your life that has Parkinson's, like don't take anything as it's being too small, just everything as like, just take note and share it because it can't hurt. Right.
Yes.
Yeah. Now,
very often, I'm sorry, but to that point, a lot of times I've told people, a great way to bring, because sometimes your appointments with the physicians are several months apart.
right.
And a lot can happen in a time frame like that, especially in Parkinson's. So, one suggestion that actually I learned from a patient was that she went to the dollar store and bought one of these magnetic pads that you can put on your refrigerator. They're like memo pads.
Yeah.
And anytime something came up throughout the interval between appointments, she would go to the refrigerator and just make, I want to remember to tell the doctor this. I want to do this.
Right.
I want to do that. And then come doctor visit day, she would just tear off that page and bring that to the appointment, because no one can remember all of these things. Now, some of the things you may be able to resolve by the time you even get to the doctor's office, so you can scratch them off. And I'm not saying to walk in there with 5 pages of stuff. You're not going to get all of that done. We know that they don't give you that much time, but at least go through the things that look like they really absolutely have to be addressed on this upcoming appointment. It's a good way of keeping track. Like you say, if you notice something strange or different, even if it only happens once or twice, bring it up to let the neurologist decide what's important and what's not.
Right.
So that's a quick little tip as far as being able to write these things down, because all of our memories they get worse and worse and worse. I live with Post-it pad. My office is full of it over here to try to keep me on task sometimes. So it's one way of making sure when you get to the doctor that the visit goes very, very quick. They're in and out, so you really want to be well prepared for it.
Right. And that visit's probably slightly stressful, slightly, and so like trying to, even myself, relatively younger, when I go to a doctor visit, like once a year, even if I thought I want to say something when I show up, I tend to like be a little bit scrambled. So, even more so if you have any sort of stressful situation, and that visit's super important to you. So, that's a great fact. That's a great tip though. I'm just thinking, I got to get some Post-it notes. My daughter loves her Post-it notes. She never forgets a thing. And I'm the extreme opposite, so I text myself now, like if I have a thought, I got to get this done today or tomorrow or in the future, I'll just send myself a text. But it's not quite as good as a Post-it note because my text sometimes is way up, and already read.
Oh,
so
yeah.
unless it's unread.
Yeah, exactly.
Now let's go and jump into 2 things, and you can decide what order. We want to talk about that medicine cocktail conversation that came up the other day. And then the exercise, exertion, freezing gait, that conversation. So whatever one, we've got about 15 minutes left to talk. So whatever one you want to jump into first, you go for it.
Okay. So yeah, a gentleman did bring up about a cocktail, and again, it really depends on how you're defining cocktail. Very often they're referring to multiple drugs that are being given to a patient. And this is not uncommon in the real world because, as we know, Parkinson's is a disease mostly of older patients. So in addition to Parkinson's, there's also just age-related issues that come hand in hand with that. So what happens is, typically is they're being treated for their Parkinson's, but they may also be being treated for their adult onset diabetes. Maybe they've got an blood sugar issue, or they've got rheumatoid or arthritis, and they've got high cholesterol, and their blood pressure is a little crazy, and the list goes on. Maybe they have some dermatological issues that they're dealing with as well. Some podiatry, maybe they've got some problems with their feet. So there's a whole host of issues that can be going on. And then what happens is spoke to a gentleman when that day we were together. I mean, he was telling me his pill load for the day, for the week, was over 70 tablets, just in a week. Because a lot of times, even just their Parkinson's medicine, if they're on, for instance, Rytari, some of them are taking 3 capsules 3 or 4 times a day. So that's 12 capsules at a minimum of just one of the drugs that they're taking. And then you add to that some of the other medications that they're taking for other comorbidities that might exist. Some of these patients are taking upwards of 15 to 20 tablets a day. So it becomes a huge issue, not only from drug interaction standpoint. When there's that many medications involved, it's almost impossible to predict the outcome drug interaction wise. In most cases, it's usually not an issue at all. The other way to look at a cocktail is there are Parkinson's cocktails that are out there. It's kind of the newest thing, where they're adding donazepam, which is one of the drugs we see used mostly for Alzheimer's, but we're finding out some uses for it here in Parkinson's. But they're combining that with another product called ginkgo biloba. This has been around a long time. It's kind of an herbal, natural product, has always been promoted for good brain health and whatnot. And a couple of other holistic / herbal type products that come from China that they've had great success with in treating stroke patients, especially ischemic stroke, where there's been a blockage or a clot in one of the blood vessels of the brain. These seems to help improve microcirculation to get around that blockage. So they're combining all of this in one cocktail for the patients to take. Now, it's very early in the game right now, but preliminary stuff as far as phase 1 and early phase 2 studies seem to show some positive results for Parkinson's patients with that, particularly with cognition and somewhat with tremor. So we'll see, to be continued on that. But that word cocktail is now becoming kind of the quintessential thing to look at right now. We're combining all different stuff. But here again, this is an oral form, and we spoke about this yesterday about using oral drugs, and that becomes problematic as far as digestion and absorption is concerned. So we'll wait and see on that note. So that there's not much else to really discuss on cocktails, because some of the medication these patients are on complex drug regimens where they're the better part of their day, especially if you're on immediate release carbidopa, you're taking that as often as every 2 hours, let's say. Mm-hmm. So it really becomes a burden throughout the course of the day. And this is why a lot of doctors try to get long-acting medications so that to reduce the pill burden. And also, if we can come up with a 1-a-day medication, we only have to deal with that absorption issue 1 time throughout the day, as opposed to when we're taking the levodopa, carbidopa every 2 hours. Now you're talking 6-8 times a day we have to deal with that absorption issue, as opposed to 1 time a day. So there's always an advantage to using the extended release, but there aren't really a lot of good ones that are out there. But they're coming. There are some new ones coming down the pipe.
That's encouraging. And I think the advice you gave over and over and over again, and you still give over and over again about many of these struggles, is just make sure your neurologist knows all that you're on. Just make sure that there's one person or some kind of an oversight. So if you've got different doctors prescribing different things, you just want to make sure somebody is on it.
Exactly. And I can tell you the best way is, first of all, it starts at the pharmacy. Try to use one pharmacy.
Good advice.
That's the best way of making sure you have uniformity. If you're going to a CVS one time and a Walgreens and then a mom and pop and whatnot, they're not interlinked as far as seeing what your medication profile is, as opposed to, like not Walgreens, CVS, or Rite Aid, or any of these big ones where they're all interconnected. So that's advantageous, number one. Number two, if you are going to a pharmacy, it's very easy. You can just ask them for a printout of my medication. You don't have to, bother writing stuff down. It's 2 keystrokes and they can print it out. It's very simple to do. And that should be brought with you on every single appointment you go to, with all your doctors, not necessarily, I mean, most importantly, of course, your primary and your neurologist, but any other time you're going to go to a doctor who could potentially prescribe something for you, you need to have that. And then as a double check, if you do get a prescription from another prescriber and you go back to your pharmacy, always ask the pharmacy, could you just check and make sure this isn't going to interact with anything else that I'm on? You know, years ago, we didn't have the references that we have now. Now we're computer-based. We can scan just by entering the drug name, and the computer can almost instantaneously detect the problem. We didn't have that technology. We had to look it up in a book or whatever years ago, but now we don't have to do that. It takes just a few seconds to do, and it's a good habit to get into. But absolutely, every visit, you should be bringing that list of medications with you.
Nice, nice, nice. And that's great advice. And that's just, I say it more than one time. I probably said it a million times to you, Bob, but the idea of having, you know, a relationship or a conversation with your pharmacist, I don't think everybody knows that. And I think that's great advice to make sure it's, you know, but you just said one place, use your pharmacist. This is all they do. They, you know, they know everything about the drugs you're taking, and this is what they specialize in. So it's super great advice.
Yes.
Yeah. So let's jump into that exercise and that freezing gate conversation.
Yes. Okay. So we spoke about, you know, balance came up a lot the other day, you know, and we didn't say it enough, I feel, but how important exercise is medicine. We know that. And just the fact that everybody there is coming to you is proof positive that they know the important role of exercise is. But I'm not so sure they understand the ramifications and how much of a benefit that really is. You know, these patients, I mean, balance and stability is key. And I mentioned this the other day. I've got all kinds of drugs for slowness, stiffness, and tremor, but there's nothing out there for postural instability. There's a drug I could say to you, okay, if you take this, it's going to improve your posture or your balance. That comes from exercise. And in particular, strength aerobic exercise is probably huge on the top of the list, because the benefits from aerobic exercise are widespread, not only particularly in the core area. You know, this is something that they need strength in when it comes to walking. It helps stabilize all the motor symptoms, the slowness, the stiffness, and the tremors can be controlled with aerobic exercise. Aerobic exercise has shown time and time again, it's one of the best things you can do to prevent dementia, is aerobic exercise. It helps build new stem cells in the brain and neuron factors that enable to protect things. There are neuroprotective ability. I mean, the list goes on and on with aerobic exercise. And that's a great thing. That's key. And I know that gets incorporated on probably everything that you do. The other is strength training. You know, this is something that they need, very important, because it improves their posture and it improves their range of motion when they do strength training. And especially the posture part of it, because the more erect they stand, the stronger they're going to be. Every time they start curving and moving that spine and leaning forward, it's a fall habit. Number one, it's a great chance of them falling. But there are also other problems that come with that. You know, when they're all hunched over, you're not taking nice big deep breaths. Your cough reflex is bad. The diaphragm is in the wrong position to do anything. So we need to stand up straight and erect, and strength training definitely does that. Balance training is another great thing to reduce the risk of fall. We need to improve their balance, and that comes with all the strength training and the aerobic training, and it also improves flexibility. That flexibility reduces the stiffness and the rigidity that they get. So those four things, between the aerobic exercise that they get, strength training, balance, and flexibility, these are all so critical for patients. And the other benefit too that they see that a lot of them don't think about, and you and I have talked about this many times, about you know, the pelvic floor muscles. This is something that's super important, and it helps in many ways. First of all, the pelvic floor muscles are essential for making sure that we get good hip stabilization. And when the hips are stable, it makes walking that much easier for them. The other thing is improved bowel movements. We get the lower pelvic muscles improved, that peristaltic activity, that's all muscular in nature. So when they've got a good, strong core and those pelvic floor muscles are working, it's going to also help with any urinary issues, urgency and frequency, leakage sometimes. These are all muscular related issues and help and all part of that pelvic floor. Peristalsis, sexual health, also very important as far as the pelvic floor muscles. So these are all the benefits that they get out of just some of these exercises, which, you incorporate all of that and they don't even often realize all the benefits that are coming from those things. And that's why exercise is as important as the medications. It's not a substitute for it, and the medicine's not a substitute for exercise. You need the medication so that you can do the exercises. But when the exercises, but now you start feeling, they get a little cocky sometimes. They're feeling great after 4 or 5 months of working out with you. Now they're feeling stronger. They're working out better. They've got good balance again. And they'll say, you know what? I don't even need my medication. Look at the improvement. My medicine's not improving anything. And I'll give them that. You could be on levodopa for 20 years. It doesn't improve anything. But exercise improves things. So don't think at any point in time, I'm just going to come off of my medication, because without that, you can't do the exercise. So, and vice versa. So it's very important. Exercise is medicine.
It's true. And we've had this conversation with some of our clients here at the gym. And that is, Mary's one of them, where the combination, in fact, she's just such a fun example of the beauty of our relationship with the medicine and movement, kind of how they can work to really, and in her case, kind of reverse some of her difficulties. She now she's got great balance, she's got great posture. And her tremors and some of the items that the carbidopa, levodopa has helped her with, combined those two. And she just is a radiant example of the two working side to side in tandem as really, really helping her just have a great quality of life. And she's thriving like crazy. And she's one of many that we can actually sit here and bring out stories about. So good point. You say motion is lotion, I say movement is medicine, but together the partnership is essential. And
it is essential.
Say about the daily dose?
It is. It's totally essential. And the sooner we can, the minute a diagnosis is made, the first thing they should be doing is getting some form of exercise, signing up for classes, doing anything they can, because it's going to be, it's a lifelong process from that point. It's not something that you're going to do for 6 months and then I don't have to exercise anymore. It's got to be part of your lifestyle, and it has to be specific. And that's why, someone like yourself who's specifically trained and certified for Parkinson's, because their needs are different than the people that walk in and just want to lose 5 vanity pounds and whatnot, and just tighten a few things up. Their direction is totally different than what a Parkinson's patients need. And that's why that good mix, you just don't want to do the same thing over and over and over again. You need that mix of the different types of exercise. And I love the boxing thing that you do with them. Boxing is just absolutely great. It helps improve balance. It shifts from one side to another. The arm movements it's fantastic for that. And that's super. That's one of the great ones that are out there. I hope more and more people take advantage of that, because you can do that at any level. You don't have to become, Muhammad Ali at these things, or, at the bag. It's just the process of doing it. And of course, the last thing that we really haven't spoken about, the benefit is the socialization that takes place while you're there. Socialization is extremely important with Parkinson's, especially for cognition. And being out there with a bunch of other people in there, and the camaraderie that exists in your group, and I've seen it many times. You guys have a blast in the class. You make it fun, and you get and productive at the same time, and that's really super important, because cognition can be. Some of these patients isolate themselves, and that's a bad thing. That's just a recipe for disaster, especially when it comes to dementia and thinking process. So the socialization is just as important.
Absolutely. I agree 100%. And we have just a minute and a half left exactly. And so there is, and there's other programs, there's Rock Steady Boxing, and there is a power, Parkinson's power, type of fitness out there nationally. And I'm hoping that, Power with Parkinson's that we do will actually, it's very much growing into other states and other gyms. So it's pretty cool. There's many people out there who really have an interest in helping this wonderful community. So super proud to be a part of it myself. And next time when we talk, let's jump into, because that second part that was brought up as far as gait. So we're going to have a conversation again in the near future. One about, and I'll discuss some exercises that help with improving gait, even with a frozen arm. We've both got tips about when you actually, get stuck in a doorway or stuck in a certain place when your body just says, nope, I'm not moving anymore. We've got some tips and some ideas that we both have talked about in the past. So we'll bring that up next time. But for now, Bob, thank you for your time. Thank you for your expertise. Can't say it enough. You're super generous with your knowledge, and I know many, many, many are blessed because of it.
I hope so. I hope we reach as many as we can possibly can. And I love doing these things. And if we can get the word out there, every little bit helps. So we'll keep plugging away. And I'll hook up with you again. I'm going to do a little research on a few things and a couple of new things coming down the pike that I want to speak about also with that. So we'll do that on the next one.
Sounds good, Bob. Have a great rest of your day.
You too. Take care, Tammy. Bye-bye.
Bye-bye.